morning, Dr. Richard Buckley and team here at MilfordMD. This morning's project is to reduce the fat pads on the lower eyelids, so-called herniating or bulging fat pads. You know, often enough people complain about dark circles under their eyes, and really a lot of the times when we look at it, there is a shadow, which is a dark circle, but the shadow is there because of bulging fat pads that are above that dark circle. And by reducing the bulging fat pads, then we can make that dark circle go away. So that is called a lower eyelid blepharoplasty. There are different kinds of blepharoplasty. Sometimes we do them to tighten skin, but we also do them to, for example, reduce the fat pads. Are patients awake? Yes?
Yes, I am.
And comfortable. And has some protective eye shields in, so that's a little wild looking, something out of Star Wars. And traditionally, often people might make an incision on the front of the lid to go in and work on the fat pads. Better idea to make a little incision on the inside of the lid, which is called a transconjunctival blepharoplasty versus a transcutaneous. So we're doing a transconjunctival in a little while. First, we're going to work on the upper eyelids. The patient has a good amount of sun exposure, and the sun breaks elastin fibers and makes things kind of droop and sag faster than they might otherwise. And in any case, you know, with time, in all of us, our brows kind of descend, and then the upper eyelids get some extra loose skin. And doing something about the upper eyelids in a very young person might just be trimming off the excess skin. If we have a few more years on us, then we need also to lift up the forehead, help reverse that brow ptosis with a P, ptosis, but it's pronounced ptosis. So after I've trimmed off this skin and tightened those lids up, and after I've reduced the fat pads here, I'm going to pop up here on the scalp in this area I've drawn out here, and I'm going to do a subcutaneous lateral temporal brow lift, in other words, a forehead lift. That's our workflow for today. At present, this is numb, so I'm counting out 10 minutes. I have a couple minutes left, and as soon as the 10 minutes is done, that means it's not only numb, but it is hemostatically secure. In other words, we shouldn't have any oozing, which means that we shouldn't have much, if any, in the way of bruising. I typically put in a stitch here that I may slide out in 6 or 7 days. And sometimes I use some dissolving stitches here. The lower eyelid, if we're reducing the fat pads, since the work is on the inner part of the lid, we don't need any stitches at all. Sometimes we do a pinch blepharoplasty, where we take some loose skin on the lower eyelid, make an incision right underneath the lash line, and tighten that skin up, and then I do put some dissolving stitches in there. When the fat pads on the lower lid push the skin forward, that skin is then traversing a shorter distance. In other words, from here to here straight is shorter than from here curved in and back out. So there's actually less loose skin here than one might imagine. And by reducing the fat pads and bringing back the more youthful curvature to the lower lid, we will find out there's much less loose skin here than one might imagine. So it's not always that we need to trim the skin. Sometimes people have, if we're trimming skin, they have loose lower eyelids, in which case we can tighten that lower eyelid up by doing a little stitch underneath in here, something called a lateral canthopexy, which we're not needing to do here today. So today we're doing an upper blepharoplasty, which is trimming the excess skin off there, and we're reducing the fat pads here. I say reducing because you don't want them gone, you want them smooth. And long ago, in the olden days, I think often people were, in an attempt to do the right thing, they were just taking out all the fat they could find, and then people might be a little skeletalized, it's called, on the lower lid, in other words, sunken in. Sunken in's not a nice look either. Bulging is maybe not the greatest, and sunken in is definitely not the greatest. And so we take out the fat that wants to come out. We take out the fat that just bulges out when we get in there to look at it. It speaks to us and says, hey, take me, and that's the fat that we do take out. smooth things out. So maybe I'll bring you back a little later and show you some of our progress. Hope you enjoyed the session of upper blepharoplasty, transconjunctival lower blepharoplasty, and brow lift discussion. Thank you for watching. MilfordMD.